afternoon.
Hello, good afternoon.
We're going to begin with Michael Bilo from Motif magazine. He notes that Rhode Island successfully flattened the curve to a plateau where hospitalizations and fatalities have stabilized. But what is the plan to bring down the numbers? The 7-day moving average of deaths is a steady 10 to 15 per day for over 3 weeks, which is obviously not sustainable indefinitely.
Yeah, so a few things. Hospitalizations are down. They are coming down, thankfully, especially over the past few days. Secondly, you have to account also for the number of tests, which is why yesterday I referenced the percent positive. So a few weeks ago, our percent positive of the number of tests we've done, our percent positive was much higher than it is today. Having said that, you're right. As I've said so many times, we are not out of the woods. We have not rounded the curve and started to come down, as you say. So what's our plan? Our plan is to go slow. You know, our plan is social gatherings limited to 5, wearing your masks, doing everything that we've learned how to do. But that's exactly why, you put your finger on exactly why I'm imploring the people of Rhode Island not to go too fast in this first phase. The risk of going too fast in the next couple of weeks is enormous. We risk going backwards. So let's go slow. The plan is to go slow and steady, to test our systems. You know, you just heard from Dr. Nicole Alexander-Scott. That's going to happen. We will see outbreaks at different office buildings, manufacturing operations, congregate care settings. We can't really stop that from happening, but what we can do is make sure our system is strong enough to get there, test people, do what we need to do, get people into isolation. So anyway, I feel absolutely confident that we can lift the stay-at-home order. We're still building our systems. We haven't rounded the curve, and so I'm asking you to go slow and follow the rules.
Our next question is from Tara Granahan at WPRO Radio. If people can't pay utility bills for the next 2 months, do those bills carry over or are they forgiven?
Yeah, they will carry over. Thank you. Unless they make further announcements. But as of now, it's only intended to give you relief. But that could change.
Paul Parker of the Providence Journal asks, what has been the survival rate of COVID-19 patients on ventilators?
That's an excellent question. We certainly know that people who are in the hospital and those who are in the ICU and ventilated automatically have a higher risk profile that led them to be there, and that unfortunately does increase the risk of people who aren't able to recover. But our first case in Rhode Island did get hospitalized, was in the ICU, was ventilated, and did recover. So it definitely is possible. I would have to look through the numbers to get you an exact amount. Our data team does a phenomenal job, so it will take time to pull that together, but I wanted to give that overall response.
Our next question is also for you, Dr. Alexander-Scott. The average age among the 4,420 people who have died of COVID-19 in Massachusetts as of Wednesday was 82. What is the average age of people who have died in Rhode Island, higher or lower? This is from John DePietro.
I can give numbers. It's around the same amount. 24% of the people who unfortunately passed away were between 70 and 79. 32% were between 80 and 89 years of age, and 23% were between 90 and 99 years of age. And that's the largest proportion of all people who have sadly passed on.
Thank you. Our next question is from Richard Asinoff of Convergence RI. The Rhode Island Innovates 2.0 strategy, released in January, a report on Rhode Island's future innovation economy, did not include strategies for investment in public health infrastructure, such as HEZs. How has the pandemic changed your assumptions about such investments to spur the future Rhode Island economy?
It's a fantastic question. And that's exactly what I mean when I say we're going to come out of it stronger than when we went into it. So in the process of standing up our economy, again, we cannot just look to do it exactly the way it was, because obviously we need to be more resilient. We need to be more technology enabled. We need to be more digitally literate. We need to invest in public health. We need to make sure that everybody has access to public health. We need to reduce our dependency on communal living settings for those who are sick. We need to train people. I mean, the very saddest part about this is that the people who are hardest hit are those who are the lowest skilled and the lowest paid. And very sadly, I worry some of those jobs might not come back, you know, if you think about, say, certain sectors. So we need to get serious about making investments in our healthcare, in our infrastructure, in our job training, so that A, we can get everybody back to work, and B, we have a stronger system on the other side of it.
Our next question is from Ian Donis of the Public's Radio. To what extent is there any sign of adverse long-term health consequences for the Rhode Islanders who have recovered from the virus?
We are still learning. As of now, we have not seen any particular trends stand out in terms of health consequences, but nationally and internationally, we are all going to learn together, particularly with the countries that are ahead of us in terms of recovery and being able to see how people are doing for the long term. We hope that it will be similar to what we see with other viruses similar to coronavirus, where in the long term people ultimately do well.
Our last question for this Saturday briefing is from Nick Papadilla of ABC6 News. Will those who have underlying medical conditions be required to go back to work once their place of business reopens? If exceptions will be enforced for those with these conditions, will those individuals still be eligible for unemployment benefits, and will this include gig economy workers?
The second part.
Okay, sorry. I apologize. Will the underlying medical conditions be required to go back to work? Yes. And will exceptions be enforced for those individuals? Yeah, okay. So here's how to think about it. Folks who have symptoms of any kind, who are sick, should not be allowed into a workplace. That is the responsibility of the employer and the employee, but the employer, in order to reopen any kind of business, has to have a screening ability so that nobody comes into the office or factory floor or store sick, fever, aches and pains, etc. For those folks who are in a higher risk category, maybe older workers, maybe those with an underlying health condition, they're going to have to work that out with their employer. So employers should take that into account and should make extra accommodations as necessary in order to make sure that folks can continue to work and earn an income, but also that they are protected. There should be absolutely no discrimination, and we are going to have our eye on that, and we're in close touch with the Attorney General. This is a time for the whole country as we go forward. We need to take extra care for those with underlying health conditions and who are our older workers, but they cannot be discriminated against. And so that's going to take some figuring out about how they can be accommodated and cared for, but not discriminated against. The gig economy workers, that unemployment insurance falls under the pandemic unemployment insurance, which is all driven by the federal government, and it'll be up to Congress to decide if and how long that initiative will last. You know, we're going to be advocating that they continue to take care of, frankly, I think on a permanent basis, I would say, gig economy workers, because they ought to be eligible for unemployment just like anybody else is. Thank you.